So errors of accommodation, I spoke about presbyopia. Now there's something called pseudomyopia, where there is a spasm of accommodation. It is seen in children, especially during their examination, when they do excessive near work. Due to excessive accommodation, what happens is there will be myopic shift. So the near vision is good and the distance vision is poor. So the treatment is to relax the accommodation with cycloplegics. What happens is like it gets stuck in near vision, so the distance vision is blurred because the patient is using a lot of near vision and it gets spasm. Like how you have muscle spasm, you'll have muscle spasm there. So what we have to do is like we have to give cycloplegics in order to relax the accommodation. So inertia of accommodation. In this condition, there is difficulty in changing focus from distance to near to near distance. This is because accommodative system is slow in making a change. So it's like that inertia is there, no? That movement of inertia in physics you would have read. So that is there in this case. So distance to near and near to distance, there will be difference. There is difficulty in adjusting. Paralysis of accommodation. In the case of cycloplegics and third nerve palsy, there will be paralysis of accommodation. You cannot accommodate. That's a problem. Insufficiency of accommodation. This is a condition where the amplitude of accommodation is less than the normal physiological limits according to the patient's age. The patient cannot accommodate more. That is what is insufficiency of accommodation. Then comes to the last topic, which is cycloplegics. Cycloplegics are basically to relax the accommodation of the patient so as to get accurate assessment of the refractive error. Atropine 1% ointment is a long-acting dilator cycloplegic with a duration of action 10 to 14 days. It is used for refraction in children less than 3 years of age and patients with squint. So what happens is in atropine ointment we always give, the others are eye drops. That's because the eye drops gets absorbed in the nasal mucosa. That will lead to a lot of other issues. So the patient might have all the poisoning of atropine, all these symptoms. There are also cases of patient getting going mad because of atropine. So that's why we always use a 1% ointment. And atropine is a long acting, but in the case of children, because the accommodation is very difficult to control, we use atropine as an ointment. Whereas in other patients, we just give short acting drops. We'll come to it. So one is tropicamide, that's short acting, that is what we routinely use in our clinical practice. It is usually used in refraction for adults. The duration of action is 4 to 6 hours. Within like 4 hours, you can happily go to your work after having this cycloplegic effect. So then there is something called homatropine. It has a duration of 3 to 4 days and it's used in school going children. So school going children cannot accommodate for a lot of time, like 10 to 14 days and all. That's why we use homatropine. Homatropine, another use is in the case of uveitis, we can use homatropine in order to have a good cycloplegic effect because there will be severe pain in the case of uveitis. Then there comes a cyclopently. Its duration of action is 12 to 24 hours, 1% drops, which we use it in again children between the age of up to the age of 16 years. Then there is last thing, which is phenylephrine. It's a dilator and not cycloplegia. So basically the only drug which is a dilator and not cycloplegia is phenylephrine. So there is no point in giving phenylephrine in the case of children or in the case of any uveitic issues, because we basically want to have a relaxed ciliary muscle. That is our point. So this is about the cycloplegics.